Welcome to Med-Surg Mini number 6, where we'll talk about fibromyalgia. Fibromyalgia is a soft connective tissue disorder that causes pain. It's the main cause of chronic musculoskeletal pain in young to mid-adulthood, and it's often comorbid with rheumatoid arthritis, lupus, and Sjögren's syndrome. We don't know how it forms, but we know that it is a disorder where abnormal pain processing occurs in the CNS. Risk factors for fibromyalgia include being a woman, having increased stress, exposure to infection, physical and emotional trauma, and there does seem to be a correlation with the menstruation cycle as well. Symptoms of fibromyalgia is pain, insomnia, fatigue, stiffness, cognitive dysfunction, headaches, and abdominal pain. There is no laboratory testing and no evidence of joint or muscle inflammation, so we can't do any radiology testing either. One way that we can diagnose fibromyalgia is by identifying 18 specific points of pain throughout the body and applying about 4 kilograms of pressure, which is about as much as it takes to cause blanching on your fingernail. If they experience pain in 11 of those 18 specific points, then they're diagnosed with fibromyalgia. And here is a picture of where those different points of pain are located. As far as treatment goes, we can provide physical therapy and strength training, aerobic exercise, cognitive behavioral training, relaxation techniques, pain relief techniques, stress reduction strategies, and then we can use medications such as antidepressant medications. This helps to balance out the serotonin and norepinephrine, which can impact the pain response. Specifically, we can use things like Cymbalta, Savella, Elavil, and Prozac. We can also use anti-seizure medications such as Lyrica. Because we have no obvious cause of fibromyalgia, opioid therapy is not recommended. As far as evaluation goes, our main nursing considerations for someone that has fibromyalgia is going to be experiencing chronic pain, ineffective coping, a depressed mood, and impaired sleep. From an evaluation standpoint, we would look for well pain management, reduction of relapse, compliance with diet and exercise, and improved sleep. And that is our discussion on fibromyalgia.